Hi. Most families contact me after their parent has gone back into the hospital with questions of why did this happen? And were there warning signs that we could have noticed? And the answer is yes, but you have to know the right things to look for. When I review a medical record after a hospitalization, I don't simply look at the emergency room record. I'm looking for patterns that lead to readmissions, so things that increase risk. Over time in doing this work, I have found that most preventable hospitalizations, they come down to 4 areas. And I call these the 4 pillars of readmission avoidance. The first one is medication review. Oftentimes in hospital stays, medications are changed. Dosages might be increased or decreased. Sometimes this information is not appropriately communicated to pharmacies, or families are unclear on what the changes are, and this can lead to side effects for medications or just confusion about medication in general. The second pillar is functional monitoring, and this is noticing any changes in mobility, cognition, how they're getting around in their day-to-day. These can be a sign of decline. The third pillar is timely follow-ups. It is difficult to get medical appointments right now with primary care providers, with specialist providers. And sometimes it's unclear for families to know what is the biggest priority for me to follow up on, which specialist or provider do I really need to push for that follow-up appointment, and what are we looking to accomplish in that appointment. But as I say, it's difficult to get appointments. And the fourth pillar is coordinated care. I made a post about this recently, that there's a misconception that all medical providers are talking to each other, and that is very much not true. There are so many different medical systems currently, and they're not all in alignment. So you really need somebody that is following along and understanding what's happening throughout all the different providers. So most caregivers are trying incredibly hard to manage all of these things. But if you don't have a clear framework, it's easy to think that everything is urgent and nothing is identified as the priority. So when families work with me, we step back and we look at the entire medical picture. We identify the risks we identify those risks early, and then we create a prioritized plan to keep your loved one out of the hospital. Because preventing the next hospitalization usually starts with understanding the bigger picture.